A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.
The Centers for Disease Control and Prevention reports that 4 out of 10 Americans' mental health have been negatively impacted due to COVID-19. And in Western New York, the opioid epidemic is on the rise. Nearly 20 counties in the state reported increases in opioid-related deaths amid the pandemic, including Erie, Niagara, and Chautauqua counties. This has amplified the need for frontline workers offering addiction and substance treatment. Today, we'll talk to the team at Spectrum Health and Human Services, where they have been serving the Western New York community since 1973. We'll get the life-saving information on this edition of your Hometown Health Connection. I'm Samantha Latshaw. Welcome to your Hometown Health Connection. Joining us is Kevin Beckman, Managing Director of Clinic Operations, Robert Cannata, Vice President of Crisis Response Services, Shanese Mills, Mental Health Clinician, and Wesley Sheffield, a licensed practical nurse. Welcome, everyone. Thank you so much for joining us.
Thank you, Samantha. Very happy to be here.
Now, Spectrum's health mission is to help individuals with mental health and addiction needs recover and lead successful lives. Tell me, how does that fit in with the clinic?
Sure, that's a fantastic question. Thank you, Samantha. Our urgent mental health and substance abuse clinic services, it really fits in neatly with Spectrum's overall philosophy to help those individuals. It gives us an opportunity and a platform to have same-day and rapid access for those individuals who are looking for immediate services.
Now, COVID-19 has changed the lives of everything that we do and everyone. How has this impacted or changed your work?
Oh, absolutely. It changed our work because we needed to pivot with the situations that were presenting themselves. So we had to change to an online platform. So we were able to offer virtual services as well as telephonic and some in person.
Now, May is Mental Health Awareness Month. It's a time to put a spotlight on the need to be mindful of your mental health as well. What makes this month so special for you? Again,
it gives us an opportunity to just highlight all the wonderful work that we are doing as an industry, not just Spectrum Health, but how we deliver services. And in addition to that, for all the individuals who are seeking services, it gives us an opportunity to highlight the services that they offer to let them know that their doors are welcome and they're open.
Wesley, this question is for you. The first week of May is designated as Nurses Week. How has being a nurse in the behavioral health space different from working in a medical setting?
I think that working in an atmosphere with behavioral health and substance use is that the nurses are always 100% available for the patients. It's not like a hospital setting where the nurse comes in on your scheduled time. If they are there to meet with their counselor and they need to speak with a nurse or a medical professional, we are always available. Come to that door, ask us a question. Your counselor may reach out to us while you're there. We're always there for you while you're in our office, or right now telephonically, pick up the phone. You're reaching a nurse if you need to right away.
Apart from dispensing medications, tell me a bit more about the mobile response team. What exactly do you do?
So we generated a mobile response team as a collaborative unit between Kevin, myself, a whole team of nurses, a whole team of clinicians to essentially go out to people's homes that were not able to make it into our clinic setting. We were able to administer the medications that they were desperately in need of, preventing them from ending up in a hospital setting. We were able to alleviate some crisis services. We're able to provide medication packaging for, clients that are not able to do it, on their own and otherwise would have been walking into our walls to do this. We were able to generate a whole team to go out to these clients that really needed our services, still, but for the most part, our doors were closed. And they were terrified to come out and, as it is, limited transportation and so on and so forth.
Wow, this sounds like a very challenging and rewarding career. Now, what would you say to aspiring nurses about pursuing psychiatric nursing?
Sure, that's a great question. in general, as a nurse, I think you always have that goal to see your patients succeed with their physical health, their mental health, all over general health. But when it comes to a psychiatric atmosphere, you get to see your patients, your clients, the individuals that you are working for set goals for themselves, and with the help of a team of people, the psychiatrists, your nurses, your therapists, actually meet these goals and achieve real positive things in their life, whether it be housing, just mental health stability, sobriety, continued sobriety, things that everybody aims for.
Kevin, tell me about your background and what led you to do such work in the field of mental health.
Oh, absolutely. So I was drawn to mental health as a youngster, in particular, in the helping fields overall. When I was in probably the 9th grade or so, I started volunteering with Rosa Gibson and Block Club Number 1, and she really introduced me into the helping field. And I started running a food pantry with her, and then out of that, really saw how the individuals we were helping was also struggling. I didn't know it was depression at the time or mental health, but she said we were helping heal their souls. So for us, healing the souls and the mind was an easy pivot for me. So I actually went into college thinking that I was going down this path. One small pivot, I was going to work with the gerontology population, but then after my first internship and working with mental health, I knew it was a natural fit for me. So with May being Mental Health Awareness Month, for me personally, it's just 1 month that's a culmination of everything that I have been doing almost my entire career and for the whole year. So I would just love to take the opportunity to tell anyone out there, please, if you're hurting, this is a time to heal. Spectrum's slogan is that it's real people who really help, who really cares. And I can see that from day to day because the entire team we put together is really out there helping change lives. And if you're out there and you're struggling and you don't know what to do, you give us a call and let's see if we can help. If you're out there and some of the things, especially with COVID-19, and you're not just feeling yourself, you give us a call and see if we can help. Treatment can last from a few sessions to a few months, really based on your need, but we are here to help. And with May being Mental Health Awareness Month, it's just an opportunity for me and the entire team we put together to just say, hey, look, we're here to help.
Kevin, I love your passion. I can feel it as you speak, and the slogan is so meaningful. What would you say to those who are watching at home who perhaps suffer from mental health or addiction or have a family member that does? What would you say to them and helping to remove the stigma so that they are actually able to reach out to you?
Absolutely, and I'm glad you said stigma because we really I think we've done great work in removing the stigma, but we have to also acknowledge that it is still there. It is not at all a sign of not being strong, or it is not a sign of weakness. All I would say, you don't have to suffer alone. You don't have to suffer in silence. And more importantly, you don't have to suffer. You don't have to go through this. There are things that we can do to help, from encouragement to talk therapy, to medication services, to we treat the whole person. Earlier, we talked about the mobile outreach team. That team really consisted of a wide range of individuals. We had targeted case managers. I often say that it's very hard for an individual to address some of those mental health or substance abuse issues if their back is hurting. It is very hard for some of those individuals to address their mental health and substance use issues if they don't have anywhere to live, right? Or they have a transient lifestyle. So we had case managers, we had nursings, we had counselors, all part of that team who are going out during COVID to meet the needs of those individuals. So if you're out there, or your family you think may have an issue, you give us a call, and I believe we can help. You don't have to do this alone.
Wesley, I want to build a bit more on what Kevin mentioned. So you as a nurse, you're not so much a nurse in the office. You meet people where they are with the mobile outreach unit. Talk to me about that experience and why it's so important to you.
Throughout COVID-19 especially, I think it's been a huge eye-opener to the team that I've worked really closely with, of the fact that we are meeting these people in whatever area they need to be met at. You're noticing that these people don't always have, the best four walls around them, and they're missing some of the necessities that you and I really do take for granted. So one of the things that we have done cumulatively is try and provide basic needs to a lot of these individuals that we serve. Besides just doing, medication therapy, we have gone out of our way to provide cleaning supplies and toilet paper and paper plates and make sure that there's non-perishables in their home. And Kevin has used money out of his own pocket to provide diapers and formula to somebody that has walked through our doors, because the struggle is there and the struggle is real. And within Spectrum, anybody that you come in contact with, we will treat you like family. We will do whatever we have to make sure that you are getting the best care possible.
Absolutely.
And that's part of our mantra, that's part of our slogan, that's what we all aim to do when we're working for this company.
Absolutely, and everything has just been exacerbated due to COVID-19. Now, this is such an important conversation that we're having right now, but before we cut to break, Wesley, Kevin, please, any additional thoughts?
I think that in general, and to add upon what Kevin had stated, no one has to suffer through substance use, issues alone, with depression alone, anxiety alone. We are working so hard as a field in general to break that stigma that comes along with mental health. All it takes is one phone call. Pick up the phone. It's a few sessions to sometimes a lifetime, but there will always be somebody there to be in your corner, to advocate for you, and to work with you.
Kevin?
Oh, absolutely. And just to add to what Wesley said is that we're here to help. Give us a call. Go to our website, see what services we have. We have the community of caring on our website, which is absolutely free. We have trained therapists and activities every day. So we are here to help. So give us a call.
We will have much more with the team at Spectrum Health and Human Services after our short break. If you or a loved one is struggling with addiction or mental health, you can call their 24/7 helpline at 716-710-5172 or online at shswny.org. You can also make an appointment at one of their many locations. Ahead, learn how parents and caregivers can support mental health needs of young people.
In February of 2020, a first-of-its-kind facility in Erie County, designed for the well-being of our community, opened its doors in Buffalo. Introducing Spectrum Health and Human Services Urgent Mental Health Addiction Care Clinic, known as UMAC. UMAC is a safe, warm, comfortable alternative to the typical ER experience, with a dedicated, personal, and caring staff at every level.
I'm a registered nurse with urgent care, and I am the first person that someone's going to see that's going to be able to help them with their needs at the time.
UMAC provides on-demand mental health and addiction services to individuals with immediate concerns, but it doesn't stop there.
This is truly walk-in. We try to be available 6 days a week where individuals can present here totally cold. We have no prior information or knowledge on an individual. They can come in here and get a litany of services and get those needs met. You present here and then we can help you.
It's just another thing that Spectrum would have that other agencies don't have. So it's another area that Spectrum is sort of dynamic and growing.
UMAC is located at 1280 Main Street in downtown Buffalo, just a visit or phone call away. Spectrum Health and Human Services. Real help from real people who really care.
Spectrum has such a great compassion for the people who not only work here, but for the people that they serve.
This is a place that can be utilized. This is a place that can save lives.
Or maybe you're just not feeling good and you just need someone to listen. And that's what we're here for.
Welcome back to your Hometown Health Connection. I'm Samantha Latshaw. We are continuing our discussion with the team at Spectrum Health and Human Services. Bob, now you guys offer a lot of fantastic programs that help both children and their families. Tell me about that.
Hi, Samantha. Nice to be here. I wanted to start out by saying that we have traditional counseling that you would expect for children and for teenagers, where somebody could see come in and see a counselor face-to-face in an office. But now with COVID, we have phone contact and we have Zoom type of teleconference kinds of sessions. So there's really never been an easier time to be able to connect with counseling. Another program that we have is our C.A.R.E.S program, and this is a 24-hour, 7-day-a-week crisis response service. So anybody could call us any time of the day or night, and they can talk with a trained counselor about any youth in Erie County under 18 years old. They can talk with that counselor over the phone. We can give resources, we can give referrals, and if need be, we could send a team of counselors out to the person's house to see them in the community. This is a program that we offer, a similar type of program in Genesee, Orleans, and Wyoming counties. And I have to say we've done this for about 12 years now, and we're starting to see some interesting things, like parents will call and say, okay, now we've resolved the crisis with the youth. They'll call back and say, now could I talk to you about my own issues? So we're always happy to do that.
Well, 24 hours, 24/7, that is so important. So you're telling me if I call you right now, if I need help right this moment, you can help me right away?
Exactly, right now. There's teams in the office to a certain time at night, and then there's people that are on call that pick up the phone, and we monitor that. We make sure that people answer that phone within just a couple of seconds to a minute or so. So it's a really nice resource for people.
Yeah, so that's definitely important, during this time, during this COVID era, because this is just so far reaching, and especially with the youth population.
Sure. They definitely have issues, especially with COVID as well. They have their own kinds of communication and connection needs, and it's hard for them to get that. So they know that they can pick up the phone and call us and get a response. Now,
do you offer any online resources? You touched upon that just a bit earlier.
Yes, we do. When COVID started, we started a program called Community of Caring, and this is a series of Zoom type of meetings, pretty much every day of the week, different times during the day, things like coping, recovery issues. We even have a dance class, a craft class, a yoga class, and especially for kids, for teens, on Mondays from 4:30 to 5:30 p.m., there's a Zoom meeting that's called Teen Talk, and anyone from 12 to 17 years old can call in, get support, and I would say overall, the main thing is they can connect with other teens. It's moderated by one of our youth peer specialists, so it's just a really nice way to connect.
No, with COVID has changed the landscape of almost everything that we do. What additional programs have you added due to COVID?
One of the programs recently is that we added New York State's Project Hope program. So this is a FEMA-funded program that's monitored and administered by New York State, and we're one of the local programs that does this. So this is crisis counseling available for anyone affected by COVID. There's a helpline Monday through Friday, and we have trained crisis counselors that can answer the phone, do Zoom type of presentations, and even do some in-person kinds of presentations with families and with businesses. We've done a number of them with businesses and agencies that have asked us to do a presentation to them and to their staff members or their teams, and we're happy to do that. That's a new initiative. Another thing we're very proud to be a part of is that we're a partner with the Western New York Human Services Collaborative, and this is a group of agencies operating out of 1021 Broadway, right across from the Broadway Market. We're in a building with Jericho Road, Mental Health Advocates, EPIC, and Parent Network, and a number of other agencies, and between floors 1 through 5, somebody could walk in the door and get just about any kind of service that they need under one roof. So we're so happy to be part of that collaborative.
Now, Shanese, this question is for you. As a clinician, you see youth clients all the time. What are some of the changes you're seeing now in kids as a result of COVID?
We have noticed heightened levels of stress, heightened levels of anxiety. A lot of kids have been struggling a lot more with depression. I think the pandemic has definitely impacted the social health, emotional health, and the mental health of a lot of the kids. It's definitely been a challenge. They've experienced a lot of changes when it comes to school, a lot of quick changes at that, and it's definitely impacted them in a lot of different ways. And we also see kids as young as age 5. And I definitely think it's never too early to start learning how to identify your feelings and your emotions, and just learning different ways and healthy ways to express that to other people.
Now, Shanese, you do a lot of work outside of a clinical setting as well. Talk to me about some of the work that you do at the Boys and Girls Club.
Yes, so it is a grant-funded program through the Boys and Girls Club, and it's really, really helpful in introducing the concept of mental health into the community, and also reducing the stigma that kind of comes along with mental health. A lot of the kids go to the Boys and Girls Club for education, recreation, and I definitely think this past year it has been a really huge outlet for them. And it's just awesome just kind of becoming a part of the fabric of the club and being able to provide emotional support to the kids when they need it.
What would you tell parents if they're noticing some differences in their children at home or perhaps at school? What would you tell them? How can parents and caregivers get involved?
That is a really good question. I have been encouraging a lot of my parents to just engage in check-ins with their children. Even just a quick 5-minute conversation about how their day is going or about how school went. It definitely goes a long way, and not just doing check-ins with their children, but also doing check-ins with themselves. So like Bob was just saying, a lot of the parents call for their children and then they call back for themselves. So it's helpful just kind of being able to do that check-in with yourself and just kind of assessing how it is that you feel and not being afraid to ask for help if you need it. We are here at all times of the day.
As a mental health clinician, talk to me personally about your journey in your career and what do you love most about your job?
I really enjoy working with the kids. Like I was saying a little bit earlier, I truly feel as though you're never too young to start identifying your feelings, your emotions, whether it be through talk therapy or just doing different activities with the kids, counseling activities, just different things that they can do to help them identify their emotions, and just learning ways to communicate that with family, learning ways to communicate that with teachers at school, other peers. It's really, really important. We've noticed a lot of behavioral challenges that kids have been struggling with because it's very difficult for them to express how they feel about the changes. So I think that's one of the things that I love the most about this job, is just being able to help kids that young. And it's really helpful just kind of getting them to where they want to be.
Now, Shanese, mental health can affect everyone from all ages. And sometimes this looks a little different for younger children as opposed to teens or adults. Talk to me about that.
Yes, so in a lot of our younger kids, like ages 5, 6, around that age range, we've noticed increased behavioral issues, behavioral problems, whether it be acting out, not listening, trouble engaging in schoolwork, either virtually or face-to-face. So we've definitely noticed a lot of changes, especially since the onset of the pandemic. And a lot of those symptoms may have been present before, but they've definitely exacerbated with the changes that have had to occur due to the pandemic.
Now, what would you tell a parent or caregiver if they are noticing some of the symptoms that you just mentioned?
I think it's important to reach out for help. Definitely give us a call. I think it's really also important to identify maybe a behavioral plan that could be really helpful to implement in the home. A lot of the kids who are in like that kindergarten, pre-K age range, they are missing out on like a lot of the behavioral modification programs that the schools implement, whether it be like the color chart system or like the card changing things that they do at school. A lot of the kids are missing out on that because they were not physically in the school setting. So I think that can be very important to implement in the home if able.
Now, Bob, your work with younger kids is more so focused on the acute emergency type setting. Talk to me about that.
Yes, yes. The calls that we get with the C.A.R.E.S team is that it's somebody that's in crisis, and crisis can look, for example, it could look like a number of things. It could be behavioral problems, school kinds of problems, it could be parent-child or relationship kinds of problems. And then we also have some severe acting out or severe situation where it might be unsafe for the child to stay in the home. We also have authority under New York state law, actually in Erie, Genesee, Orleans, and Wyoming counties to authorize the police or an ambulance to take somebody to the hospital against their will for an evaluation. We use that very carefully, and it's only in a situation where the person can't safety plan in the home and resolve the crisis without doing that. So we really are kind of like a soup to nuts kind of a response. From phone call to the extreme would be we're out on a visit and we have somebody taken over to the hospital for evaluation.
Now, if a parent finds themselves in an emergency type situation, of course they can call 911, but what is the number that you also recommend to call if they want to contact you?
There's the C.A.R.E.S number, and that's 716-882-4357 directly if you call that. And again, this is all on our website.
If I could have, please, any final thoughts and any message you want to bring home to those watching.
I would encourage people to call Spectrum Health to get any kind of access to the services that we have. One of the things that we'll do too is if we don't offer a particular service or it's not exactly what the person wants, we'll either tailor make that service to them or we'll connect them to other services. So my message to anybody watching the program is that we definitely have help available, and we're all in this together. We really do need connections, and we need new ways to look at things so that we can address problems not just alone, but with the help of other people.
Shanese, final thoughts?
Yes, to add to that, we are a collaborative team. If you ever need anything 24 hours a day, you can definitely just give us a call. We have a team full of people. We have a lot of adjunct services that we also offer, especially for kids. Like I said, we kind of start off at age 5 all the way through adulthood. And if you're a parent, if you're a client, if you're a child, just definitely feel free to give us a call.
I definitely feel the love and passion for the work that you all provide to the community, and thank you so much for the work that you do.
You're very welcome.
Thank you.
If you or a loved one is struggling with addiction or mental health, you can call Spectrum Health Human Services at 716-710-5172 or online at shswny.org. Their helpline is open 24/7. You can also make an appointment at one of their many locations. Behavioral health is an integral part of everyday healthcare, and Spectrum Health and Human Services can help get you back on the right path. I'm Samantha Latshaw. Thanks for watching. Stay safe and be well.
A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.